You're listening to Oklahoma Perspective. Diabetes patients have received very good news recently. The per-dose price of insulin has dropped significantly. KRMG's Russell Mills talks to Paul Seegert with PCS Advisors about what this means.
Some news out of Eli Lilly, and the way you put it to me was this is huge. Kind of tell me what's going on.
Yeah, this is the biggest news around insulin in 100 years. For the last 100 years, we've had three companies that have basically run a cartel controlling insulin, and they've done that by continuing to improve insulin, and the way our patent rules work, they can continue then to extend their protection, and they've strung protection to protection to protection together for about a century, and they are now under so much pressure, I think, just politically, socially, in the news because of the work being done with people like you, that Eli Lilly, one of the three, came out today and announced that they are voluntarily reducing the list price of insulin, their insulin products, by 70%.
Which is huge. All right, so
yeah.
that brings that imposes a cap of patients' out-of-pocket costs at $35 a month. That may be coincidental, but that's exactly what the Biden administration had called for, had wanted. Yeah. Yeah,
I think they're working in partnership or collaboratively with insurance companies to kind of make that happen. This will obviously make that a lot more doable. Ultimately, the copay will still be determined by your insurance, but the fact that the overall cost of this product is going down this much will certainly make that more feasible. And the Biden rule had impacted those on Medicare, which accounts for about half of diabetics in this country. The other half didn't benefit from that. And the other issue with that was true, at least until today, was that limiting the copay didn't limit overall costs. So it's great to have a smaller copay as a consumer, but if the manufacturer of the drug just pushes more cost to the insurance company, then they're just going to increase your premium at renewal. So this is, to me, this is a really, I mean, it's kind of a mind-blowing event. And I think, yeah, it made me step back and say, why are they doing this voluntarily? And I think it's because there's just enough momentum and pressure culturally right now. And also, these three companies have enjoyed a monopoly for 100 years, or, a quasi-monopoly. There's only three of them. I think they're under enough pressure that they're looking at this and say, why don't we voluntarily do some things? Better to keep this, make less per transaction, but let's keep this cornering of this market that we have. Otherwise, there's enough momentum out there. There could be some real serious changes that could impact this. So I think that's part of it.
So what are the other two companies in this, I guess, triopoly, if there is such a thing?
Yeah, Novo Nordisk and Sanofi are the other two. And it'll be interesting to see if they follow suit. It would not shock me. I mean, they're going to be under great pressure competitively now.
Well, that was kind of my next thought was, well, will they? And has there been any response, reaction, statement, anything? Because certainly somebody's asked them by now.
Yeah, not yet that I've seen.
So
I'm sure it's imminent.
Did this? And I mean, you have your finger on the pulse of the industry, to coin a phrase, and this one took you by surprise, yeah. So
absolutely.
Did you see it coming at all, and how did you find out about it?
No, not really. I, like so many others, I saw it in the news. I read the Wall Street Journal every morning. I saw it in the Wall Street Journal, and I immediately started to reach out to people I knew so that we could talk about it. I mean, it really is incredible. You don't see this. I mean, they're under great pressure, clearly, and see that there is perhaps, even though there hasn't been, and often there isn't, we have so many good lobbyists in this country. There's 14 or 15 lobbyists around healthcare for every member of Congress. So we don't see things change much in the way that we'd all like to see them change a lot of times. So this comes as a surprise, and I think it tells you that the winds are blowing strongly enough that even with all that lobbying power, there's they're seeing as an industry, hey, we're not going to be able to keep this the way it is forever. Let's kind of like when the movie industry said, we'll do our own rating system as opposed to letting someone else jump in and do it. I think there's that element happening, and it's a really amazing moment.
I think that's a good metaphor. It's like, well, we better regulate ourselves, or somebody's going to do it for us, and that may not turn out so good for us. Yep. So, do you know what the market share is for Eli Lilly as far as the insulin market is? Are they the big one of the three, or is it split?
Yeah, they have the biggest. The most commonly prescribed insulin is Humalog, and that's an Eli Lilly product. So they are kind of the bellwether, I'd say.
And that is one of the two that they specifically said that they are going to be capping the price on. And the other one was Humulin, which I guess, I don't know what the difference is between Humalog and Humulin, but...
Well, they have branded generics, so they have such a strong control over it that the company that controls it also makes their own generic. So it's kind of, is it really a generic? It's the exact same product, but with a different label. And a lot of times, that even though it's existed, it hasn't been that available because of other kind of oddities of the way our system works. You can't get it if it's not on the formulary for your health plan. So the fact that it exists hasn't helped as much as people thought it might because people haven't had great access. So I think the bigger thing is the reduction on the branded version, as that is still what most people are accessing.
Let's go back to what you said earlier. They've had a patent for 100 years because what they do is they wait until towards the end of the patent period and then they change the formula somehow so that they can keep it going. Explain that to me.
Yes, in our system, if you improve a drug, Humira, most commonly prescribed specialty drug, they were doing this for decades, and you change it and it's better, maybe you make it slow release or whatever, then you can start over, in simple terms, your patent protection. So that's has been done by these three companies, and it's not likely coincidental that as those protections are close to expiring, new versions come out. And that's not allowed in all countries. It's a little bit unique to our system, and maybe I think you could make an argument that it hasn't worked really well for us in the fact that we don't have generics for things like this that have been around this long. And to answer your prior question, they've got about a quarter of the market share overall, Eli Lilly.
Paul Seegert.